How's it, and welcome back to my channel. Today we're going to be going through a hemoglucose test, an HGT or a BM, whatever the word you want to call it. We're going to be talking about what this is, how it works, and how to use it, and all the tips and tricks that I could hand to you. What is it? What does it do? So really what it is that it allows us to prick someone's finger and test how much sugar is in their blood, right? It tests the blood in the capillary. I'm going to go through all the pieces of equipment that is here and all the options and all the things that it can and can't do, right? So as you can see, we have pieces of equipment. So the main things that we need is obviously we need the machine, and we need to make sure that we have the right sticks for this machine. Sticks for another machine won't work for this machine, right? So we have to have the correct sticks. We need to make sure that it's the right thing. We also need to make sure that they are in date. If they are not in date, it won't be accurate, but also sometimes the machine will just say, no, not actually happening. So there we go. Other ones, which are maybe the older ones, come with a little piece of plastic, kind of like a coating, that then you have to then insert that little piece of plastic that has the coating into the machine. So if you don't have that device that sticks into this, then you're not going to be able to use this device at all. So just be careful of these things, right? These are important. Then in terms of drawing blood, so there's multiple options, but these are the two main options. Then obviously you get this device that you can just take apart, and then you can then put your needle in the top, right? Your needle, it's all once-use needles, comes off here, gets attached on the top, and then you can pick it into there. This then allows you to then set how deep you want the needle to go. So you can do a 0, which is like very, very shallow little prick, maybe for like a child. And then if you've got a builder with really thick hands, then you're going to pull it all the way to a 9, which is then going to be the deepest. You pull this back, the red little dot appears over there. You're going to put it onto the finger, and you're going to hit the button and poke the skin. So that's pretty much how that device works. Then there's this device, which is pretty common. You actually get pediatric ones, and so it's got a smaller needle. It just goes less deep. You literally just turn off the end here, pull this out, apply that to the patient's skin, push the button, and you draw blood. All right, so that's pretty much the the basics of what that kind of works. We have a alcohol swab to clean the skin. Some will say don't clean, some will say clean, some will say when you do clean, wait for that alcohol to then leave the finger. I will put some interesting articles in the comments below, and I would love for you to comment on what you think about it. The other thing is that you can also perform tests. So you can also draw up fluids from these little vials, and each vial has a different amount of sugar in them. So you actually are testing the device to see how accurate it is at picking up the correct amount of sugar in the fluid. So it's important to do your test. I'm not going to run through that whole process right now. So what's the process in this? So what we're trying to do is we're trying to draw blood from the capillary, all right? And so often what people will say is that we should be pricking on the side of the finger, because, I don't know, maybe that's less painful, maybe there's less nerves there. To be honest, I'm not entirely sure it really matters where you prick. It is a little bit sore. I'll tell you a bit of a story at the end of the video if you are interested to kind of stick around for that too. A bit of a funny thing that happened with me and a patient. Actually, maybe even 2 stories. But yeah, let's just jump straight into this. So how does this work? So we need to grab a stick. All right, these are these little sticks. Remember, the right stick for the right machine. And as you can see, there's a little barcode on the one side type thing, and then there's a little what kind of looks like blood can go inside, and then there's arrows. So you stick that into the top or the bottom. Sometimes it's top or the bottom. Here you stick it in the top. We're going to take our alcohol swab. We're going to take this out, and we're going to clean my finger. All right, that can stay there. You can wait for this to clean a bit, or wait for this to dry rather. We have a little pricker. We're going to apply it to our finger. I'm going to just do it in the middle. We're going to push it down onto the finger, so don't just hold it like gently on the skin. Push onto the skin and push the button. There we go. You see there's a tiny bit of blood that's now coming out. If you want to do yourself a favor, lower this finger below the patient's heart, because if you bring this above the patient's heart, it actually makes it harder to then get blood out of there. But all you need to do is you take the finger and you just gently milk. You see how blood just appears, right? Take a little bit of piece of blood on the finger and you just draw up. There we go. Then you can just take that, apply some pressure, and there we go. And there is my sugar. It is 5.6. So normal. I'll put normal onto the screen. This is in millimoles per liter. So that is the process. Then these obviously are now got like blood in them. So we should then throw this into the hazardous material waste. Sorry. So that's pretty much how you take your blood sugar. So as you can see, it's still coming up my finger. So it'll be nice to give them like, something to just put some pressure on them and stop that bleeding, because obviously that's going to annoy them. And if you just give them the alcohol swab and just get them to then pinch that just for a moment, it'll stop the bleeding. If someone has very thick callous skin, if they're builders, if they deal with like bricks all day long, it is quite challenging because they have very thick skin. And so what happens is that when you try and prick them on their finger, this doesn't even go through the skin because it's so callous. So your options are to get a hypodermic needle and put the hypodermic needle through the skin to then draw blood. And so this story that comes along was when I was a student, I was, taking sugars at a hospital to help out the nurses, and this lady came in and I pricked her finger on the side and I couldn't get blood out, and I pricked again and I couldn't get blood out, and I even pushed harder and I pricked again and I couldn't get blood out. And I'm like, gosh, I'm really struggling here. And then she goes, why don't you just prick in the middle? And I was like, well, we've normally been told to prick on the side. And she's like, why? And I was like, because it's meant to be, I guess, less painful, or maybe there's less like nerves there. And she goes, but wouldn't there be more blood in the middle? And I was like, yeah, maybe. so that's what I did, and blood came up. So instead of pricking her 4 times, I could have just pricked her once, right? So it was a good idea to do that.